Hey folks, today I want to cover a topic that's near and dear to my heart, and it is the concept of directional resistance. Directional resistance is kind of this main concept that permeates through all the Morales Method programs, the Pain Specialist program, the Deep Tech program, Deep Tissue program, and MASI, the Morales Method Academy of Structural Integration. And this concept really helps us to hone our palpation skills, to differentiate what we're feeling when we're palpating, and really helps us to create a body of work that we can actually see results from. So let me talk about the concept of directional resistance, and we can go from there. First off, like I've mentioned a few times now, it's a concept. It's not a law. It's not a theory, not a rule. We're still playing with this idea of directional resistance. In its essence, it's a palpatory sensation that the practitioner feels when they sink into end range, and then they feel resistance in one or more directions when they apply force in one or more directions. As I mentioned, the first thing that we have to do is we have to sink into end range. So first off, my fingers, let's say I'm picking this area right here. First off, my fingers need to sink into end range. So what does that mean? End range is the level of depth that you reach just by slowly sinking into the tissue without being forceful. I'm here at this layer of depth. And now we need to do something that is really kind of sometimes challenging for practitioners to do. And that is we have to commit to this layer of depth. So here I am. Once I've sunken into this layer, I'm here. I'm not pulling away. I'm not bouncing up. I'm not going back to a superficial layer of skin or hair. I sink in to this layer of depth, end range, and I commit to this layer. I'm here. Now we have to apply force. Now that I'm here in this layer of depth, wherever this is, now I have to apply force. And I'm going to angle and apply my force first towards my hand. And I need to listen and see how easy or difficult it was for me to do that. And now I go back to my starting point, back to center, and now I move towards my elbow. And again, I'm feeling for difficulty, for resistance in that direction. Hence the name directional resistance. And I feel some resistance, and I make a note of it. And then I go back to center. And now I'm moving away. My hand is moving away from my body, almost at an angle, that way right there. That feels pretty easy. I don't feel directional resistance there. And I go back to center, and now I move my fingers towards me, almost towards my right shoulder. And in that direction, so in this direction, I'm feeling the most resistance. So then I would say that the directional resistance is in this direction. Under the concept of directional resistance, once we find the direction, then we aim to work in that direction. Usually we apply force in that direction for a period of seconds, possibly even a minute or so, until we have resolution, and I'll discuss what that means. So what we're doing here is we're using this concept under a few assumptions. Usually in class I ask my students, once they've done this exercise of feeling for directional resistance, I'll ask my students, how many people felt DR, directional resistance? How many people felt DR towards their hand? Some people raised their hand. So how many people felt DR away from their body? Some people raised their hand, and so on. Usually in a room, you'll get different people with different DRs. And I'll ask them, why is it, if we all have the same tissue, we all are made up of the same stuff physiologically, biologically, how come we have different DRs? So without me answering the question, people start to answer it themselves, and they come up with the hypothesis or ideas that maybe it has to do with function. Maybe the function of their muscle, how they use their bodies, actually creates tension in the same area, but different from person to person. So, that's an interesting assumption, and I tend to agree that function may then affect form, and in this case, the form is the tension of everything in here, not just muscle, not just fascia, but everything in this area. Blood, bone, nerve, lymph, skin, hair, adipose tissue, everything that is in here. Function is actually creating possible tension lines in this area. So if that's the case, if we follow that assumption, then if people are different and if function may be affecting them differently, it's also possible that dysfunction affects directional resistance. And if dysfunction affects directional resistance, then could it be possible that if we work in the direction of resistance, that we may be affecting function and dysfunction? Hopefully, we're affecting dysfunction in the sense that we're resolving dysfunction, right? So that's kind of, in the nutshell, the concept of directional resistance. Again, maybe sinking in here, feeling for directional resistance, and then working in that direction of resistance to resolve any possible dysfunctions. Notice I didn't mention anatomy. I didn't mention the muscles that are under my fingers here. And the reason is not because I don't believe in anatomy or anything like that, but it's because when we're working a particular area and working in the direction of resistance, we're really feeling everything under there. We can't really differentiate if it's just one muscle or two muscles. It could be a group of muscles. In this case here, it may actually just be brachioradialis. But if we're working on the back, we have multiple layers of muscle tissue on our back. So I can't necessarily say I'm just working, for example, the directional resistance of the rhomboids, when in actuality, it could actually be a blend of what middle or upper trapezius and rhomboid and some erectors are doing in that area. I did mention adipose tissue, and the adipose tissue has its own layer of effect on a particular territory. I haven't mentioned fascia yet, and I don't want to ignore fascia, but I also want to mention that when I'm working in this area, I'm not necessarily just working fascia. It's really difficult to differentiate what I'm working in this area, but I know that it's not just fascia. I'm touching, when I sink in here, I'm touching everything that's here and everything that could be affected by directional resistance. Some modalities use sort of similar ideas or concepts. They may be calling it something different. Directional tension or myofascial tension. I like the term directional resistance because, yes, it's broad, but it doesn't necessarily need to be specific in order for us to kind of bring the concept into our work and have it be kind of integrated into whatever other modality that we're working with. So, that's another kind of interesting thing with regards to the concept. You can bring the concept into your work without you having to kind of take the whole idea of structural integration, for example, hook, line, and sinker. Let me go back to the topic of resolution as I was previously talking about. So let's go back to this area. And let's say that I found directional resistance in this direction, in the distal direction towards my hand. And I worked in that direction. Like I said previously, I could be working in for 40 seconds or a minute in this area. And there might be a feeling of fluidity. It might feel a little more fluid. It might feel like I can move in that direction a little easier. And that's when I believe we've kind of encountered resolution in that area at that point in time. The interesting thing about directional resistance is that there could be a resolution in that direction, but it could also be possible that now I'm able to sink into another level of end range, and there could be a different direction of resistance in the same area. It's also possible that if I move just over here, even on the same muscle, but just a little further down, the directional resistance is different. This is possible because although we're working with the same muscle, we're not necessarily working with all the other materials that are here just in this area. We have different type of possible fascial tension, possible adipose tissue here, accumulated adipose tissue, or blood, bone, nerve, all of these other things that could be affecting the direction of resistance here compared to here. Going back to the topic of resolution, let's say, for example, I'm working here in this area and I'm here for a minute or 2 minutes. Under the Morales method, we don't believe that you need to be here for as long as it takes in order for there to be fluidity or for there to be kind of a difference in what we're feeling. So that's important to note. If you don't feel anything, there's no additional fluidity or resolution, as I mentioned, then maybe it's time to go somewhere else. Maybe the system isn't responding to your work for a particular reason, and that's when the next other questions come up. Well, where else would I have to work in order to possibly bring resolution in this area? And that's that's kind of a group of questions that falls under the topic of structural integration. The other thing I want to note is that notice I didn't say kind of a popular word that's said a lot is and that's release. I didn't say that we brought about release, and the only reason I don't bring up that word is because I'm not exactly sure what could be released. When it comes to some of the classes that we teach and we feel this kind of fluidity feeling, sometimes we'll experience a twitch under our fingers. There's an actual muscular twitch, and that could be part of a muscular decontraction, which is specifically what it is, but we don't say necessarily muscle release. We use the term decontraction to describe what's actually happening. Let's talk about directional ease. Directional resistance meant sinking into end range and feeling what direction was most resistant. In this case, it happened to be this way. Now, it's possible that there is the opposite of directional resistance, which is what we call directional ease, or DE. Now, just because directional resistance is in this direction doesn't mean that directional ease is in that direction. It's not necessarily the exact opposite. It could be that directional ease is in a different direction. And as I come back here and I feel for directional ease and directional resistance, I want you to note how much or how little my hand actually moves. I don't have to travel really far to feel for this directional resistance. Now, granted, I've been doing this for a while, and I think I've honed my palpation skills to the point where I can feel it, and it comes to me right away. When we're first starting out with this concept, you're going to have to really kind of listen quiet the mind, and really listen to what's happening under your fingers. And this is one of the things that I really like about this concept, that is that it really pushes me to hone, to ground, to really be present with my client while I'm working. And believe me, the client really feels that when you're there with them and you're present with them working in a particular area. So, coming back to this, directional resistance still feels like it's this way. Directional ease feels like it's this way. So I could work also in the direction of ease. And it's the same thing. I sink into end range and I slowly move my fingers. In this case, my middle finger is doing most of the work. Slowly move my fingers in the direction of ease. So the question might be, well, Marty, when do you do directional, when do you work in the direction of resistance, and when do you work in the direction of ease? And usually I start off working in the direction of resistance. Sometimes I think of myself as am I a one-trick pony, because I normally go to directional resistance first off. But I know that directional ease tends to be a great approach for people who are in an acute condition. So if they are feeling pain, if they're in pain, I may start off with directional ease instead. The other thing that I'm aware of is, let's say I'm working on a client and I start off with directional resistance, but they're not in an acute situation, and I don't feel like there's resolution. I don't feel like maybe there's any fluidity in the area after I work there for a minute or two. So then I could switch to direction of ease. And again, I really take my time working in one direction, working with one concept. It's really important not to jump around from one direction to another. When you jump around like that, it really gives the client this kind of feeling of tentativeness from the practitioner. And what you really want to do is kind of convey this feeling of, hey, I know what I'm doing, I'm working in this area. But let's say we don't get resolution, then the next thing would be then to switch to working in the direction of ease. And that's what I end up doing. Usually there is a result, there are resolutions from one way, working one way or working the other. And working in these ways really covers kind of a broad base of possibilities of working with tissue. As with directional resistance, I don't necessarily think about anatomy right away or muscle groups. When I teach the concept and I'm in a class, I do bring up anatomy because people need to understand, students need to understand exactly where I'm at. But when it happens to, in the private practice setting, I'm working with territories and I'm working with these concepts in territories. So it's important to know we know our anatomy, but it doesn't govern exactly how we're going to work that area. Hi folks, thanks for your interest in our demonstration of directional resistance. If you want to see more on that topic, then please click this way. If you want to see directional resistance in action, then please click on the video link below. Also, if you want to be up to date on Morales Method YouTube content, please don't forget to like and subscribe this way. That's it, folks. I hope you're well, and I hope to see you soon. Thanks.